So some people ask the question, is mental health genetic? The answer to that really is yes, and it depends on your circumstances. A lot of the conditions that affect our mental health are best understood through a model that honors both genetic as well as environmental influences. So for example, with depression, you may have a significant genetic vulnerability to developing depression, but if your life circumstances are such that they don't include the sorts of experiences that would bring depression out, you may not actually experience depression. On the other hand, if you have a small vulnerability to depression, but your life is full of these events that are associated with depression, like losses or conflicts or adverse experiences, then you might actually experience clinical depression. So there's a lot of overlap between depression and anxiety, but they are distinct, different conditions. Remember that depression more has to do with that feeling that just feeling uncharacteristically down, like not yourself. People feel like terrible, they feel worthless, they feel even guilty. Anxiety more has to do with that sense of tension, worry, fearfulness. And I think it's important that they're distinguished, because when it comes to treatment, oftentimes there's a little bit of a different treatment aim with these. Even with medicine or with therapy, we look at a little bit of a different goal. So if you're confused about which one is going on for you, it's good to just reach out and talk with a mental health provider who can give you kind of an objective assessment about what's going on.